Have you been diagnosed with a C5, C6 disc bulge and are tired of endless therapies that just don't work? In this video, you'll discover a groundbreaking treatment that targets the root cause of C5, C6 disc bulges, offering immediate relief and long-term stability. Most importantly, it helps you avoid surgery, which is a top priority for all my patients. I'm going to take a deep dive into 3D non-surgical spinal decompression therapy, the most advanced and effective treatment for addressing the root cause of disc bulges and protrusions. Unlike other treatments that only mask the symptoms, this non-surgical therapy targets the actual problem, dehydrated and compressed discs, offering real lasting relief. I'll show you why this method outshines traditional approaches. With a combination of chiropractic adjustments and laser therapy, the decompression table not only alleviates neck pain and arm pain, but also promotes the long-term disc hydration and disc health. It's the perfect solution for those who wish to avoid surgery and prefer non-invasive methods to treat chronic neck pain radiating to shoulders, numbness and tingling, arms, hands, or severe headaches, migraines caused by C5, C6 disc bulges. If you want to see how you can regain neck mobility, reduce muscle weakness, and improve your overall quality of life using spinal decompression, all without the risks associated with surgery, keep watching. Stay tuned until the end. As a bonus, I'll share a simple at-home neck traction technique that you can start to relieve and alleviate your pain today, even before you visit a clinic for professional decompression therapy. Hi, I'm Dr. Raminder Burke, a chiropractor in Woodbridge, Ontario, Canada. We have helped thousands of patients recover from spinal conditions such as disc bulges, herniations, degeneration, lumbar stenosis, sciatica, and radiculopathy. We use non-surgical spinal decompression as the cornerstone of our unique and proven Back to Life method. Be sure to hit that subscribe button if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your back, leg, neck pain at home. Plus, you will discover which therapies are best for treating disc bulges, disc herniations, and other spinal degenerative conditions. I'll upload a new video every week. In addition to that, I wrote a book called Back to Life. Imagine getting your life back while getting your health back. You can get a free copy at the link in the pinned comments below. Now, before I show you how spinal decompression works to effectively treat a C5, C6 disc bulge and alleviate the associated neck and arm pain, it is important to understand the anatomy of a C5, C6 disc bulge, what it is and why it causes so much pain. When it comes down to it, the main thing that is at the root of this condition is the disc needs movement. So every time it's in alignment and you're moving your neck throughout the day, it creates a fluid exchange in the cartilage of the disc. So as you move and it's healthy, there is no problem here because the disc has the space that it needs to maintain the open nerve. This is what we're looking for in a healthy situation. But when it's not healthy, it's obviously for a reason. And that reason comes down to alignment. So as the alignment has shifted over years of stress, whether it's car accidents or gradual situations at work, placement of posture in our neck, on phones, it locks up the spine into what we call subluxation, leading to a compressed effect on that disc. So as that disc compresses, this is what a bulge begins with. It begins with a compressed disc space and a compressed nerve. What are we going to feel from that? Obviously, the local stuff in the neck, sorenesses, stiffnesses, waking up with neck spasms. Then it's starting to spread into shoulder conditions, pain, range of motion problems, frozen shoulder, limited problems there, as well as it goes down the arm pain, numbness, tingling, burning, weakness in the hands, grip strength going down, dropping things. All of these are signs of an underlying condition at your C5, C6 disc. People are having problems sleeping, people are having problems functioning. So as we continue that degeneration further permanent, we cannot reverse it as it gets too late. We always want to catch this condition at the right time. So while there are various treatments available to alleviate this neck and arm pain caused by C5, C6 disc bulges, such as physiotherapy, acupuncture, injections, none are as effective as spinal decompression at targeting the specific issue of the disc injury and the compressed disc. You may have heard of spinal decompression being used for lumbar disc bulges and herniations, such as those at the L4, L5, L5, S1, but we offer this treatment for those conditions as well. However, many people don't know that the same technique can be successfully applied to the cervical spine and the neck area. And so what does spinal decompression mean? How does it work? Why it's so effective in treating a C5, C6 disc bulge or a C5, C6 disc herniation? We're going to go to the table, show you how it works in person on the table itself. So here's an example of a spine model on the cervical decompression component of the table. The head is here, the spine is placed and angled. The table can be angled. These are 3D decompression, meaning I can angle and target the C5, C6 disc, which we know is compressed due to the problem causing a bulging effect and a herniation if it's severe. Creating the vacuum effect by decompressing means we're pulling it apart over a series of pulls and relaxations that help fluid come back into the disc. The negative pressure, the vacuum effect, is going to help restore the disc, which is compressed and dried out. Hydration is the correction of the cause. Getting fluid back in means your disc gets full again and gets restored. The disc is not worn out. It is compressed, and most importantly, it is dehydrated, and we're restoring hydration, creating a mechanical pumping action again, permanently restoring the disc, which gives you the long-term solution on the nerve root, which opens up down the arm into the numbness and tingling, reducing the symptoms all the way up the spine, and a long-term relaxation as the disc gets pulled. This feels very good over a series of 15 minutes. We're going to place a patient next to see what it looks like with someone else. I wanted you to see how the disc is getting hydrated during spinal decompression. All right, so we have the wonderful Miss Ashley here demonstrating the cervical decompression table. Obviously, we have a patient sit down at a comfortable position. I'm going to have you lie back. We're going to have her head placed right in that same harness we were looking at with the spine model, right at the base of the skull. So it's really gentle. It's a cushioned harness that supports the skull, and we've angled her to get to that C5, C6. A simple strap just to keep the head in place during decompression is going to help assist. As I set the program on the table, the pounds, everything's very calculated. The program is calculated. It's going to gradually increase pounds over each session, during the session, of course, and each session we go up to a maximum for the body weight. So as that's applied, as we saw on the model, the table is pulling, relaxing, pulling and relaxing. Feels very good and comfortable. Yes, Ashley?
Oh, yeah.
Awesome. So that's really what it comes down to, is creating a gradual process of correction, including our other treatments that are assisting the decompression. Chiropractic adjustments, laser therapy, at-home stretches and exercises. A neck orthotic may be given to those without curvature in the neck. So restoring the neck in all manners is the key components of our spinal decompression back to life method. So there's been countless stories, great stories about the recovery from using the spinal decompression with our patients over the years. Please go to our Google review section and read through many of these. I'm going to share one of them with you. Kudruta shared an amazing story. I walked in Dr. Burke's clinic defeated and scared. I was experiencing severe pain in my neck, eye pain, numbness in my right arm, and tingling in both arms and legs. I could not sleep. I had difficulty driving. I was a big mess altogether. He recommended an x-ray right away before we started any type of treatment. My C4, C5, C6, C7 were degenerated, bulging, lack of lordosis. After 4 treatments, I could see an improvement. We are now halfway through, and I can say that I'm starting to get my life back. I improved like 80%, and we are just halfway. I cannot thank you enough, Dr. Burke, Donna, Bianca, and Ashley. They are welcoming me all the time with a great smile, accommodating me in a case I need sometimes to change an appointment. This is the best chiropractic clinic I've ever gone to. Reading Dr. Burke's book has enhanced my knowledge on how the nervous system works and how these beneficial treatments are for our bodies. I'm not just getting healed, but also educated. She highly recommended it. So it's a great story. There's countless stories. This is the results that we're looking for when we give a patient the recommendation for spinal decompression, because it's the most effective treatment for the C5, C6 disc bulges. It's the solution that patients like yourself have been looking for. Now, as promised, I will show you a simple at-home neck traction technique that you can use to start relieving your pain today. Always remember, these types of exercises are best done as part of a comprehensive treatment plan. However, in the meantime, even before you visit a clinic for professional decompression therapy, here's an exercise you can do at home. It's a neck traction. Really simple. Roll up a towel, place it at the middle of your spine and your neck, and just first of all, feel that gentle pull. So you're going to put your head back, pull with a light force moving forward in this case to feel the decompression on the discs and just easing the tension in your upper back and neck area. So all you're going to do is simply go from neutral to back, neutral to back 10 times. You're going to give it a gentle pull as you get more comfortable with this. So as you go back, pull forward. That gives a bit of traction and helps restore some of the curve in our neck. From there, the more advanced ones that we can do is creating a traction on the back of the skull. So you're going to take the towel, place it and wrap it around the back of the skull and just lift. So as I lift up, I'm getting an effect on that C5, C6 disc. We're creating traction just like decompression tables, so it gently pulls up on the spine. So same way, we can pull and relax, pull and relax. Some patients feel better as they bring your chin down and do it. Some feel better with their head extended slightly, so that gives a pull in that good direction. So as we do these 3 sets, 10 to 12, take your time, breathe through the exercise. Creating that traction effect is going to be some of the best things that we can do to help alleviate that stress on our C5, C6 disc at home. I hope this information has been helpful in understanding the benefits of spinal decompression therapy for C5, C6 disc bulges. Remember, consistent care and the right treatment plan are key to achieving lasting relief. If you have any questions, ask them in the comment section below. And if you found this video helpful, please hit the like button and subscribe to our channel and share it with others who might benefit. Don't forget to grab your free copy of my book, Back to Life, from the link in the pinned comments below. The next video you should watch is this one, where I give you a complete C5, C6 disc bulge exercise following along the routine. Go watch the next video here.